The physiological changes that occur during pregnancy are the result of hormonal and metabolic adaptations that are necessary to support the developing fetus. There are many changes in the mother's body, which include hormonal changes, pigmentary changes, vascular changes, and connective tissue changes. Mothers may gain weight, grow navy, freckles, and melisma, and they have striated gravidarum on their belly. Some of the changes are benign changes that can be resolved through cosmetic interventions after delivery. Now, here are some tips on how to stay healthy and sexy during pregnancy. 1. Get enough exercise. The American College of Obstetrics and Gynecologists recommends that during pregnancy, women should perform 30 minutes or more moderate intensity exercise on most days of the week. Study has shown that previously inactive and active healthy women are at low risk for adverse fetal or parental events if they participate in routine physical activity during pregnancy. There are different types of exercise you can choose, like aerobic exercise, progressive resistance strengthening, stretching exercise, yoga, walking, and qi. These exercises are proved to be safe for mothers, fetus, and infant as long as you use self-pacing techniques and don't do too much intensive exercise. Then you can benefit a lot from the regular exercise. First, fitness. Maternal benefits from exercise during pregnancy include improved cardiovascular function, a low risk for gestational diabetes in women who are obese or not obese, improved strength and lean muscle mass, improved sense of well-being, enhanced sleep, and reduction in bone density loss and physical discomfort. Especially if you stretch frequently, you would have a decreased incidence of gestational hypertension and an increase in antioxidant markers at the time of delivery. Second, weight management. A study showed that women with normal weight and do exercise with care demonstrated less weight gain during pregnancy and less postpartum weight retention. So it's important to keep active during pregnancy. Third, general health and psychological well-being. A meta-analysis shows that the mean prevalence rate for antenatal depression is 10.7%, with a range in the first trimester of 7.4% and in the third trimester of 12.8%. Body image satisfaction during pregnancy is also an important determinant of psychological well-being. Researchers found that a healthy body image could offer protective effects against depressive symptoms during pregnancy. Regular exercise and activity may help to achieve this goal. If all of these benefits above cannot motivate you to exercise, then at least exercise for your child. Children of women who exercise during their pregnancy have lower birth weight, increased gestational ages, and potentially improved neural development. As they grow, they maintain a leaner body mass index compared to the children of non-exercising mothers. Thus, start to be active and don't let the lack of time and laziness become your shield. Number 2. Keep a healthy diet. Pregnancy is a time when many women gain weight they subsequently retain post-pregnancy. Almost 30% of pregnant women gain more weight than it is recommended by the American Institute of Medicine guidelines. Increased weight postnatal was also found to be a strong indicator of being overweight 15 years later. The more weight gained during pregnancy, the more likely that it may be retained postpartum, causing more problems to both the mothers and the infants. Interventions with dietary aspects may be the most effective in helping women gain a healthy weight in pregnancy. Don't let pregnancy become an excuse for you to eat whatever you like or whatever you think that is good for your fetus. Remember that there is no need to eat for two, and you actually only need to eat just a little more food. It is important to improve nutrition intake by consuming more fruit and vegetables or iron-rich foods. Exercise is another effective way to improve energy and reduce fatigue. Moreover, during different phases of pregnancy, the body needs are also different. Requirements to support fetal growth and an increase in basal metabolic rate heavily weighted towards the third trimester. So massive energy intake during the first and second trimester can lead to an increase in maternal fat deposition. Thus, don't trust your intuition and research on your diet. Number 3. Change your haircut or clothes. It would be harmful if you still use hair dye product, but it is safe to cut your hair. Try different hairstyles and have fun with the changes. Stop worrying about you cannot fit in the old clothes that you have. Weight gain is inevitable during pregnancy, so go shop more clothes that fit your current shape. There are various brands especially designing clothes for pregnant women. Number 4. Enjoy massage therapy. Try to let your significant others to do the massage for you. Massage therapy can reduce prenatal depression and decrease salivary and urinary cortisol levels. Massaged women have less depressed mood and disturbed sleep patterns, as well as less pain, lower stress hormones, and fewer prenatal complications, including a lower incidence of prematurity. To have mothers less depressed during the neonatal period would likely enhance their bonding to the infants, as in turn, the newborns are also less likely to be born prematurely and low birth weight, and they have lower cortisol levels. Moreover, massage not only benefits mothers and infants, but benefits their significant others as well. Massage by significant others has helped by lowering their anxiety levels and their stress hormones. Number 5. This is the last tip. Tell yourself you're the greatest person in the world. Remember, all the changes, include hormone changes or weight changes during pregnancy, are natural and necessary process. So don't focus too much on your body image, since negative body image can only result in identity crisis and low self-esteem. Be proud of yourself and tell yourself that you are doing one of the greatest things in the world. After you have done all the 5 tips above, you will become healthy and stay sexy during your pregnancy. And after 10 months later, you will have a cute baby like mine, and you will still be as charming as me.